Hi, my name is Amy Kimberlin, and I will be discussing eye disease, specifically dry eye disease. Eye diseases are a significant public health concern, with millions of people globally and in the US affected by conditions that can lead to vision impairment or blindness. The most common eye diseases include cataracts, glaucoma, age related macular degeneration, diabetic retinopathy, and refractive errors like myopia. Approximately 12 million people in the US over the age of 40 have vision impairment. Globally, over 2.2 billion people suffer from some form of vision impairment, with over 1 billion cases preventable or unaddressed. The prevalence of most eye diseases does increase with age. Women are more likely to suffer from eye diseases partly due to hormonal factors and longer life expectancy. African Americans have a higher prevalence of glaucoma, while Caucasians are more prone to macular degeneration. Diabetic retinopathy disproportionately affects Hispanic and African American populations due to higher rates of diabetes. Major risk factors for eye disease include aging, smoking, diabetes, high blood pressure, and prolonged exposure to ultraviolet light. Disparities in eye disease range from lack of access to regular eye exams to individuals without adequate insurance to having reduced access to eye care providers. This leads to a delay in diagnosis and ultimately in treatment. Determinants of eye disease are a complex mix of biological, environmental, socioeconomic, and behavioral factors that influence the development and progression of various eye conditions. We've already touched mainly on the biological reasons, but the one I wanted to highlight was for genetics. Having a family history of certain eye diseases can increase the likelihood of developing the conditions. They've even identified specific gene mutations for several of these eye disease categories. Environmental determinants. This increased exposure over the long term to UV rays can increase the risk for certain types of ocular cancers and also cataracts. Pollution. Air pollution, particularly an exposure to particulate matter, has been linked to an increased risk of dry eye disease. Couple that with like your climate and humidity, living in an area with a low humidity or extremely dry climate can exacerbate dry eye symptoms. The workplace exposure, often not discussed, but having exposure to prolonged screen time, as we'll see in some of our studies, can increase the risk of eye strain and certain diseases. Lifestyle and behavioral determinants. Smokers are up to 4 times more likely to develop macular degeneration compared to non smokers. And they also develop cataracts earlier than non smokers as well. The next area is diet and nutrition. As a dietitian, I like to focus on diets because those that are deficient in vitamins and antioxidants can be also linked to higher rates of certain eye diseases. Where on the converse, diets rich in vegetables, right, fruits and fish with those omega-3 fatty acids, which we'll see in our studies, can help reduce the risk. I've already mentioned the screen time and that digital eye strain, but when we consider our next category, of socioeconomic determinants, this access to healthcare and having the regular eye exams is really essential for early detection and management of the eye conditions that many individuals may not have access to because of the cost, the distance, or the lack of insurance. And I've already mentioned these chronic health conditions can also increase risk for certain eye diseases. The cost of eye disease is substantial, both in terms of direct and indirect costs related to lost productivity and reduced quality of life. In the US alone, the economic burden of vision impairment and eye disorders is estimated to be $139 billion annually. When you consider the direct healthcare costs like medical expenses, this would include your doctor visit, a diagnostic test, and treatment like surgery or medication. This is estimated in the US at approximately $68 billion annually. Considering medications and devices also included with these direct costs, Americans spend about $16 billion alone just on eyewear. Indirect costs would be something like lost productivity. So now you have a vision impairment or blindness that can result in a decreased workforce participation, so not going to work, and even has led to some people having to retire early. If you require caregiving costs, many individuals may need this due to their vision impairment and need assistance with their daily tasks. And this leads to an increased cost, not only for caregiving, but also whether or not a family member or someone paid professionally is there to help. The quality of life. So, beyond these financial burdens, eye diseases significantly impact your quality of life, which can lead to depression, social isolation, and even a loss of independence. Our aging population is something to consider. As our population ages, the cost of eye disease is expected to increase, particularly due to this growing prevalence of age related conditions. So, again, in summary, eye diseases really do impose a significant economic burden on individuals, healthcare systems, and society. In early intervention and preventative care can help reduce these costs. Dry eye disease is one of the most prevalent eye conditions, ranging from 5% to 50% globally. And looking at a pooled prevalence in this meta analysis, it was 8.1% here in the US. Dry eye disease, as a simplistic way to look at it, is when your eyes don't produce enough tears or your tears are not of good quality. Dry eye disease is a chronic condition that can be controlled. However, it does not go away. And if left untreated, it can permanently damage the eye. So your signs and symptoms are what you would think to be described, but it's a burning or stinging. The eyes can appear red. They may feel scratchy or gritty. They may have some blurry vision. This eye fatigue is described as just overall a heaviness and that their eyes feel tired. They may be a little more sensitive to light. And sometimes that first morning feeling when your eyes crust over is sometimes very common in patients. And again, just an overall eye strain when they are actively looking at things. The conventional treatments currently are artificial tears as your first line, which then could progress to a prescription eye drop like a corticosteroid to reduce the inflammation. Nasal sprays can also help increase tear production. Another idea is to do some lid hygiene. By massaging the eyelids, it can help unclog some of the glands that are actually clogged and dry eyed and help secrete some oils that they normally would be doing. Collagen or silicone plugs would also help to block these tear ducts, which helps moisture on to create moisture on this eye surface. And lastly, a heating mask. These can be used to treat some of those clogged ducts as well and reduce the inflammation. When we look at the epidemiology of dry eye disease, global prevalence estimates vary widely. Estimates list 1 in 11 people worldwide have been diagnosed with dry eye disease. Recent increases have been suggested because of smartphone use. Approximately 16 million in the US have dry eyes. The prevalence is higher in older adults, especially those over 50, and it does increase with age. Women are more affected than men, potentially due to hormonal influences postmenopausally. Dry eye disease in men is found to be 10.5%, where in women it's found to be 17.9%. Risk factors include age, gender, environmental factors, medical conditions, medications, contact lens use, and ocular surgeries. Higher rates of dry eye disease have been observed in Asian populations, showing 31% in China as compared to the US at 15%, in urban environments where pollution can play a significant role. Cultural factors such as differences in diet may also influence the prevalence of dry eye disease across different regions. Dry eye disease can significantly affect patients' quality of life, causing chronic discomfort, reduced work productivity, and difficulties in daily activities. Often underdiagnosed and undertreated, despite its significant impact on patients' daily functioning. Dry eye disease poses a substantial economic burden, including direct healthcare costs with doctor visits and medication, and indirect costs related to decreased work productivity. Estimates in the US show $55.4 billion dollars to the economy each year. Overall, dry eye disease is a common condition and it does have some considerable variability in prevalence due to age, gender, geographic location, and individual risk factors. Dry eye disease develops when the eyes are unable to produce enough tears or when the quality of tears is poor, leading to insufficient lubrication of the eye surface. The two types of dry eye disease include aqueous deficient dry eye. Here, the lacrimal glands fail to produce enough tears, and evaporative dry eye. This is the more common type where the tears evaporate too quickly. Let's take a closer look at the pathophysiology of dry eye disease. Designated in the two types as I mentioned, some of them can have an overlap as to the underlying causes. So let's take a closer look. First, there's an imbalance in tear production or evaporation. Tears are essential for keeping the eye surface moist, protecting against infections, and ensuring clear vision. A healthy tear film has all three layers in balance. You have your lipid layer, your aqueous layer, and your mucin layer. The second reason would be the meibomian gland dysfunction. These are located in the eyelid and they produce the oil or the lipid layer of the tear film. When these glands become clogged or inflamed, they reduce the oil production. 3. Tear film instability. When the tear film becomes unstable, it breaks up too quickly, leaving dry spots on the eye's surface. This instability can result from poor quality tears or insufficient tear production. Inflammation and immune responses. When the tear film is disrupted, the eye's surface becomes exposed, leading to irritation and inflammation. This inflammation can damage the cells responsible for producing tears. One example is Sjogren's syndrome, where the immune system attacks the glands responsible for tear production. Another cause is neurogenic factors. So now you have damage to the nerves in the cornea, whether it's from an eye injury, surgery like LASIK, or even prolonged contact lens use. And that reduces the sensitivity of the eye, leading to reduced tear production. Environmental and lifestyle factors can also contribute to dry eye, whether it's prolonged screen time, the use of air conditioning, heating, or wind, or even the smoke and pollution. Medications can also reduce tear production, and those include antihistamines, beta blockers, diuretics, and some antidepressants. Dry eye disease develops due to a combination of these, and the condition is chronic and important to address the underlying causes and contributing factors. The first therapy we'll take a closer look at for dry eye disease are omega-3 fatty acids. These polyunsaturated fatty acids are essential because the body cannot produce them on its own, and they must be obtained through diet or supplementation. The three main types of omega-3s are alpha linoleic acid, or ALA, eicosapentaenoic acid, or EPA, and also doxahexaenoic acid, or DHA. How are they used in the treatment for dry eye disease is primarily because of their anti-inflammatory properties and their role in supporting the health of the tear film. Omega-3 fatty acids, particularly EPA and DHA, have been shown to help reduce this inflammation in our eyes, and this also helps to improve with less of the inflammation and improved function of the meibomian gland, and can help with better tear production and improved tear quality. Omega-3 fatty acids are also believed to stabilize the tear film, which reduces dry eye symptoms, helping to keep the eye surface moist. Also, they've been shown to improve the consistency and composition of tears, helping to slow down the evaporation. So now we're going to take a closer look at the studies to see the results. Our first study is by Kangari et al., which is a randomized double-blind clinical trial. 64 patients with dry eye symptoms, 33 people in the treatment group, and 31 people in the placebo group. Our treatment group received 2 capsules of omega-3s that had 180 milligrams of EPA and 120 milligrams of DHA for 30 days. Our placebo group received 2 medium chain triglyceride oil capsules daily for 1 month. When we look at some of these tests, we're going to see these throughout our study. So I want to give a quick brief description here as I'm referring to them throughout each study. Our first test that's evaluated for the eye health is our tear breakup time. This is the time required for dry spots to appear on the surface of the eye after you blink. So the longer it takes, the more stable the tear film. The mean tear breakup time in our placebo group was not significantly different from the baseline value, whereas the mean tear breakup time in our treatment group increased by 1.7 seconds, and this was statistically significant. Our second evaluation tool is the Ocular Surface Disease Index. This is a standardized questionnaire designed to assess the severity of dry eye disease and its impact on the patient's quality of life, which is a self-reported tool. So the higher the OSDI score, the more severe the symptoms. At 1 month, the mean OSDI in our control group increased, which indicates there were worse symptoms, whereas it significantly decreased in our treatment group. The next test is a Schirmer's test. This measures the amount of tears produced by the lacrimal glands over a set period of time. I do have a picture of it on the next slide, but to kind of picture this, it's where a patient's sitting comfortably, they have a small strip of sterile filter paper placed in their lower eyelid in each eye. They close their eyes and the paper stays there for 5 minutes, allowing tears to be absorbed onto the strip. So after 5 minutes, they remove the strip and they look at the amount of moisture that's been absorbed. And this allows for us to measure in millimeters the wetness and again, ultimately tear production. If it's normal, it will wet 10 millimeters or more in 5 minutes. If you have mild to moderate dry eye, it only goes between 5 and 10 millimeters. And if you have severe dry eye, it only wets for less than 5 millimeters. So in this study, the mean improvement in our Schirmer's test was 22.3% in our treatment group and only 5% in the placebo group. Now, limitations in this study, it was a very short duration of treatment at just 1 month, and there was no control over the dietary intakes on our subjects. So, what are the conclusions? This study demonstrated that oral consumption of omega-3 fatty acids, 180 milligrams of EPA and 120 of DHA twice daily for 30 days is associated with a decrease in the rate of tear evaporation, an improvement in dry eyes, and an increase in tear secretion. Our second study for omega-3 fatty acids is by Bhargava et al. This is a randomized double-blind study that had 522 participants, 256 in the treatment group that received 180 milligrams of EPA and 120 milligrams of DHA. That was 4 capsules twice daily for a total of 2,400 milligrams for 45 days. The control group had 266 participants and they received 8 capsules of olive oil. This study was conducted in the northern part of India, and they recruited people who were using visual displays for long periods of times, so high screen time use. Exclusions were anybody with allergies, contact lens use, or a history of laser surgery, and they were instructed not to use any artificial tears at least 2 hours prior to the testing. No differences were noted in a male-female distribution, and the average display time was 7.9 hours in our treatment group and 8.2 hours in our control group. Evaluations took place at baseline, 30 days, and 45 days after the start of the supplement. So when looking at kind of indications for dry eye disease, at baseline in our control group, 22% had abnormal Schirmer scores, 43% had the abnormal tear breakup time, and 28% had an abnormal cytology, so the level of inflammation that you're able to see. Whereas on our group that was going to receive the omega-3 fatty acids at baseline, 24% had abnormal Schirmer scores, 41% had abnormal tear breakup time, and 32% had abnormal cytology. The results of the study did demonstrate that the omega-3 fatty acid users for 45 days did show a significant improvement in not only the patient's dry eye symptoms at baseline, 30 and 45 days, but there was also a significant improvement in the tear film breakup. Now, this was only noted after 45 days, but they were discussing that there really wasn't an optimal dose of the omega-3 fatty acids, and the duration of the intervention is really kind of what's critical in achieving a therapeutic benefit, and also why it could explain why the tear production did not improve. So our limitations, 26 did have fish burps and it was really severe, so they had to discontinue the trial. They do believe a longer follow-up period would help to assess the long-term efficacy and in the sustained improvement in our tear film stability and overall health. This study was only looking at young and middle-aged virtual display users, and that limits the generalizability to other populations like the elderly or those with different underlying reasons for dry eye disease. And again, remember, this is an environmentally induced dry eye from a screen exposure, which may not reflect dry eye causes seen in non-virtual display users. The conclusions. Omega-3 fatty acids in a dose of 2,400 milligrams per day for 45 days does improve dry eye symptoms, tear film stability, and the level of severity of their dry eyes in visual display users that have symptoms of dry eyes when compared to those with placebo. A longer duration might be needed to show improvement in tear secretion. Our third study is by the same author as the previous study. And when I was looking for studies, there weren't as many as I expected to find, but this just happened to have a study from 2015 and then they retested in 2023 due to interest in retesting after COVID, not only with the lockdown and obviously virtual display users using screens, but also because of the use of masks and that possibly increasing dry eye symptoms. So once again, a randomized double mask interventional study in the northern part of India. Same exclusion criteria, but however, they included diabetes and liver disease this time. They also included if patients were not able to swallow pills or capsules, they were also excluded. Now, there were 470 virtual display users, and they received 4 capsules twice daily for 6 months this time for the omega-3 fatty acids. Each capsule, again, similar as to the previous study, received 180 milligrams of EPA and 120 milligrams of DHA. Now, 480 people were in the placebo group. They again likewise received olive oil capsules, and again, they got that twice daily for 6 months. Patients were also instructed to eat a normal diet, so no additional dietary supplements of extra allowances for any fatty fish, and no over the counter antioxidants. Patients were seen at the baseline 1 month, 3 months, and 6 months. Once again, some did still have fish burps and a little GI and disturbance, and 70 patients discontinued the study for unknown reasons. Now, at baseline in our placebo group, 80% of the patients had a low omega 3 index. This shows their baseline level of omega 3s that they have in their body from the start. 20% had abnormal Schirmer scores, and 48% had abnormal tear film breakup. 44% had increased tear film osmolarity, and 30% had abnormal cytology. In our group that received the omega 3 fatty acids at baseline, 82% had a low omega 3 index, 22% of the patients had abnormal Schirmer scores, and 46% had abnormal tear film breakup time. 42% had an increase in tear film osmolarity, and 34% had abnormal cytology. The OSDI index in this omega 3 fatty acid group revealed that there was a significant change in the mean index over 6 months of intervention. So, dry eye symptoms in our group of omega 3s revealed that there was a significant change in that symptom score over 6 months of intervention. The Schirmer test in that group as well revealed there was a significant increase in the mean Schirmer scores over 6 months of intervention, and the tear film breakup time in this group was significantly increased in the mean tear breakup time scores at 6 months. As mentioned, some limitations, even in our previous study, as in this study, they were not able to directly compare this study with other placebo controlled trials. This was an Indian population versus an American population, and they do have different dietary practices. It was noted in India that the fish is not an essential component of their diet. And what was even more interesting is the fish that they do eat has a lower omega 3 fatty acid content than compared to sources like salmon, tuna, or mackerel that have higher amounts. So, not only this lack of fatty fish, along with their vegetarian diet, could also explain why they started off with that low baseline omega 3 index. This study did enroll larger controls than other studies, and our conclusions show that omega 3 fatty acid supplements are effective in relieving dry eye symptoms and improving dry eye indices in symptomatic virtual display users in comparison to the placebo group. And more importantly, this benefit seems to be marked in patients that even started with a low omega 3 fatty acid index. So, when we consider our studies for omega 3 fatty acid, in our first study in Kangari et al., it is safe and efficacious. This study demonstrates that supplementation with omega 3s is associated with a decrease in the rate of tear evaporation, an improvement in dry eye symptoms, and an increase in tear secretion. Our second study, Bhargava et al., his first study, is safe and efficacious. This study also demonstrated that supplementation with omega-3 does improve dry eye symptoms, tear film stability, and that level of severity of their dry eyes, the Nelson grade, in visual display users that have symptoms of dry eye when compared to those with a placebo. Yes, a longer duration might be needed to show improvement in tear secretion, but he followed up in his second study in 2023, so our third study for omega 3s, and showed it is also safe and efficacious. And this study was able to demonstrate that supplementation with omega 3 does also relieve dry eye symptoms, and even in people with that lower omega 3 fatty acid index from the start. I also found a meta-analysis that looked at 17 randomized clinical trials using omega-3 fatty acids for dry eye disease, whereas to date, the effect of both dietary consumption and supplementation with omega-3 fatty acids on signs and symptoms of dry eye disease is still in question, and with mixed results. When they took a look at all of these different studies in this meta analysis, the pooled results indicate that omega 3 fatty acid supplementation does provide benefits with dry eye symptoms, tear breakup time, the Schirmer test in patients with dry eye disease. The limitations, and that was discussed throughout the research and why more is needed, is they could not identify any relationship between the efficacy and the dose and the duration of the treatment. So the optimal omega-3 fatty acid dose, or when looking at omega-3 and omega-6 fatty acid ratio and a duration of treatment for achieving these therapeutic benefits is really yet to be identified. And so future and further randomized clinical trials are warranted. The second therapy we'll be taking a look at for dry eye disease is vitamin D. Vitamin D is a fat soluble vitamin that functions as a prohormone. It plays a critical role in helping the body absorb calcium and phosphorus, which are essential for bone health. Vitamin D is also involved in immune system regulation and can be obtained through sunlight exposure, certain foods like fatty fish and fortified dairy products, and supplementation. The body converts vitamin D into its active form, calcitriol, which helps regulate calcium levels in the blood. Traditionally, vitamin D has been used for various health claims, particularly in supporting bone health by enhancing calcium absorption and preventing conditions like rickets in children and osteoporosis in adults. It has also been claimed to play a role in immune function, helping to reduce the risk of infections, and has an association with improved mood and mental health. Additionally, vitamin D has been studied for its potential role in reducing the risk of chronic diseases like heart disease and even certain cancers. Vitamin D is being seen to be used for people with dry eye disease due to its potential role in addressing the inflammatory and immune dysfunction aspects of the disease. It helps regulate the immune response and reduce inflammation on the ocular surface, which is often present in dry eye conditions. Additionally, vitamin D promotes the production of antimicrobial peptides and improves the health of the tear film by influencing the meibomian glands, which produce oils that prevent the tear evaporation, thus supporting tear stability and eye hydration. While vitamin D is commonly associated with sun and skin health, it also plays a role in reducing the eye inflammation, again, promoting tear secretion and improving tear quality. This ongoing research suggests that if there is a link between low levels of vitamin D and dry eye symptoms, it's important to get adequate vitamin D to help maintain eye moisture and overall eye health. Again, vitamin D is a fat soluble vitamin, meaning it can be stored in your body for a long period of time. However, even though sunlight is also a common way for people to get vitamin D, the sun rarely provides enough for us to have adequate levels. In fact, around 41% of the US population has a vitamin D deficiency, making it an essential vitamin to include in your diet. Also, on the flip side, only a handful of foods contain significant amounts of vitamin D, which can be found in fatty fish, cheese, and egg yolks. More discussion as to the importance of vitamin D as we see within dry eye disease. In our first study with vitamin D, it was looking at the association between serum vitamin D levels and dry eye symptoms, and then also the impact, if any, with an oral vitamin D supplement. There were actually three linked studies that were performed to investigate this role between dry eye disease and vitamin D levels. In the first study, there were 29 older adults. They monitored again their vitamin D levels where some had dry eye and others did not. The second study had 29 dry eyed patients, and again, their vitamin D levels were monitored. The third study had 36 individuals that were taking a vitamin D supplement for 2 months that was 1,000 international units, and they were known to have dry eye. In our older group, that first group of the 29 participants, 24 showed vitamin D levels that were low, and these did correlate with their ocular surface disease index score, so that severity and how they felt living with dry eye. Their Schirmer's test was correlated with their dry eye symptoms, but the vitamin D levels were not correlated with the tear breakup time. So overall, in older adults, the vitamin D levels were negatively correlated with dry eye symptoms. Our second group of 29 dry-eyed patients, there was no significant findings that were observed between a vitamin D level and their signs and symptoms of dry eye disease. The vitamin D levels, again, were not correlated with an improvement in their OSDI score or the tear breakup time. They did also happen to assess if they had spent any time outdoors, but again, this did not have an association with any improvement in their vitamin D levels. And in our last study, those that received this vitamin D supplement, their corneal staining, which shows the health of the cornea, was actually significantly altered by the vitamin treatment. And their OSDI score was also lower. So again, their overall feeling of the severity of their dry eye disease improved. So what does all this mean? The results in that older group of individuals showed that vitamin D levels were actually negatively correlated with their dry eye symptoms. In the second group, the vitamin D levels of people with dry eye disease also was not correlated with any improvement overall in the severity of their dry eye disease. And in the last group with vitamin D supplementation, the findings actually did support that it could be possible to monitor vitamin D levels and looking at the ocular surface health and seeing if it does improve. Again, dry eye disease is a complicated multifactorial condition with many causes, so it's kind of hard to say and take away from this study if it improved. Now, again, 10 subjects in this last group of individuals started with vitamin D levels that were optimal. But even with these normal vitamin D levels, they still had dry eye disease. In 20 of the subjects that actually were low in vitamin D to start with, having the supplementation, so improving their vitamin D levels, their OSDI, that severity of dry eye, actually improved. So the takeaway from this study is that it suggests monitoring serum vitamin D levels if you are managing dry eye disease might be useful, whereby if vitamin D is low, a supplement can be of benefit. Further studies, longer treatment duration could be possible and useful to see and monitor. Our second study took a look at vitamin D supplementation in patients with dry eye disease after having LASIK eye surgery. 90 patients underwent the surgery and had dry eyes 1 month after their operation. They divided the subjects into two groups. Our experimental group of 45 people received vitamin D3 at 2,000 international units per day for 12 weeks, and the control group also had 45 people and they received no oral supplementation. The ocular surface disease index score, the tear breakup time, and the Schirmer's test were evaluated at 1, 3, and 6 months after treatment. They also looked at the serum vitamin D3 levels, and cytokine levels in tears were also measured. Patients who took the oral vitamin D3 supplement after LASIK surgery showed a significant improvement in their dry eye symptoms compared to those who did not receive the supplementation. Their symptoms like dryness, irritation, and discomfort that are typically reported after LASIK surgery were reduced in those that received the vitamin D3 supplementation. It was also shown to improve the tear film stability and tear production, which were those issues post LASIK as well. Tests like the tear film breakup time and the Schirmer test also indicated an enhanced tear film quality in the patients that took vitamin D3. Keep in mind, vitamin D3's anti-inflammatory properties have been also shown to help reduce that ocular surface inflammation that can occur post LASIK surgery. And it's thought that this reduction in inflammation helps to support a quicker recovery and better management of dry eye symptoms in that post LASIK period. So, our study overall highlighted that patients having a low pre surgery vitamin D level were actually more likely to develop dry symptoms after LASIK. Supplementation did help reduce the severity of the symptoms and suggests that maintaining adequate vitamin D levels could play a role in post surgical eye health. And while the study does present some promising results, it was a small sample size, there was short follow-up period, and there was a potential lack of control for other influencing factors that could limit the scope of the findings. More research is needed with a larger, more diverse population and a longer follow-up to really confirm these results and the effectiveness of vitamin D3 supplementation for a LASIK-associated dry eye condition. In our third study, patients received vitamin D supplementation and artificial tears or just artificial tears. This was a non-randomized controlled trial that had 108 patients. Group 1 received artificial tears 4 times a day, and Group 2 received oral supplementation of 6,000 international units along with the artificial tears over 90 days. Both groups had 54 participants. They compared over time the ocular parameters in both groups, the tear breakup time in seconds, the Schirmer's test score in millimeters, and the ocular surface disease index, along with a numerical pain rating scale as some of the outcome measures. The study revealed significant improvements in tear breakup time and Schirmer's test scores in the patients receiving supplementation. This would indicate that the supplementation may enhance the tear film stability and improve overall ocular surface eye health. Now, when you consider both groups did experience symptom relief, it was still seen in the vitamin group, supplementation group, that they showed an even more pronounced enhancement in the tear breakup time and their Schirmer's test scores. And that suggested a superior effect on their overall ocular surface health. The study also noted reductions in that OSDI and pain score in our vitamin supplementation group in showing improvement in their symptoms relief. An increase in the tear breakup time showed the potential improvement in the overall tear film stability, which also is essential for maintaining ocular surface health. Now, because there was such a significant increase in that tear breakup time, this might suggest the role that vitamin D3 supplementation plays in enhancing tear film stability and potentially reducing dry eye symptoms. Vitamin D actually might not only be acting at the ocular surface level, but also at a systemic level and possibly modulating the immune response. Now, some of the limitations in this study, there were promising findings. However, the limitations included a small sample size, a short duration compared to other studies, and in order to validate these results, further research with larger sample studies, extended follow-up time is recommended. Additionally, exploring the cellular and molecular mechanisms involved could really provide deeper insights into the therapeutic role of vitamin D3 for dry eye disease. Our evaluation for vitamin D on dry eye disease. Our first study concluded that oral vitamin D supplementation is beneficial for patients with dry eye disease and low vitamin D levels. Again, it is a potential therapeutic option in managing dry eye symptoms in those patients with vitamin D deficiency. It was safe and efficacious. Our second study looked at a particular reason for the dry eye disease, so a LASIK eye surgery, where other studies didn't attribute the reason as to where and why patients had dry eye. However, with these varying baseline levels of vitamin D, the study may not have sufficiently accounted for these individual differences. However, the study was safe and efficacious. Our third study showed that oral vitamin D supplementation could serve as a new treatment option in patients with low levels of vitamin D, again, safe and efficacious. And Birabino et al., although it wasn't a systematic review, they did do an examination of the literature to see the role that vitamin D levels were playing in people with dry eye disease. They concluded it did have a positive effect either by modulating the immune and inflammatory response, and so therefore should be considered as an effective therapeutic strategy in patients with dry eye disease that are not responding to conventional treatment. They also consider that a pharmacological dose, so over 10,000 IUs, might be required to restore the status if one is vitamin D deficient. There are also a limited number of clinical studies examining vitamin D's impact on dry eye disease. Recommendations for treating dry eye disease with omega-3 fatty acids. Take a dose between 1,000 to 2,000 milligrams of omega-3 fatty acids per day. Look for supplements that provide a combination of EPA and DHA. Choose high quality fish oil, looking for supplements that are third party tested for purity to ensure they do not contain heavy metals or other contaminants, which can sometimes be present in fish oil products. Omega-3s work best when taken consistently over time. You may not notice an improvement immediately, as it can take several weeks to feel the effects. Take omega-3 supplements with food to help with the absorption of the fatty acids, but also to prevent fish burps. Before starting supplementation, consult with your doctor and/or healthcare provider, especially if you are on blood thinning medications or have other health conditions, as these may be affected by an omega-3 supplement. Omega-3 supplementation can help reduce inflammation and improve tear quality, which is beneficial for managing dry eye disease. Stay consistent and make sure to choose a reputable brand for best results. Vitamin D supplementation may play a beneficial role in managing dry eye disease. And while the evidence is still emerging, here are a few things to consider prior to starting a supplement. The dose for vitamin D supplementation is 1,000 to 2,000 international units per day. However, some people may need higher doses, particularly if they have a deficiency. Your doctor and/or healthcare provider can help determine the right amount based on your needs. Choose vitamin D3, which is the form that is more effective at raising vitamin D levels in the body as compared to vitamin D2. Take vitamin D regularly. It can take several weeks to see improvements in dry eye symptoms, as the goal is to improve your levels of vitamin D gradually over time. Before starting vitamin D supplementation, consider getting your vitamin D levels checked, as this will help your doctor determine if you have a deficiency and whether you need a higher dose to correct it. Again, vitamin D supplementation does show some early promise in treating dry eye disease. Check with your healthcare provider prior to starting supplementation. All right, let's take a closer look now at a few other complementary therapies that are used in the treatment of dry eye disease. Now, the first item that I did throw in there was an actual other supplement. And the reason why I did so is because this study that they did was just released in 2024. And I felt that it was very pertinent to just this idea of taking oral supplements and looking for something that's in theory more natural. So these Blink Nutritier supplements contain medium chain triglycerides, some turmeric, so those antioxidant properties, some gelatin, some linseed oil, so again, some omega 3s, a little bit of thyme oil, some olive oil, even some vitamin E and even some vitamin D. So it's got a mix of quite a bit of things in there, but they actually, again, had the study. It was over 56 days, a randomized placebo controlled trial that did show improvements overall in the tear volume, their ocular surface disease index score, and again, as compared to placebo, these findings showed improvement in the Schirmer's test and all of the other parameters that we've been looking at. So I think it's really kind of insightful to see now some other areas of supplements besides it just having an omega 3 fatty acid. The second treatment is what we call a Bruder mask, and this is also very commonly used to treat dry eye disease. You can target the meibomian gland dysfunction and use moist heat therapy. So you heat the mask up in the microwave for 25 seconds, you wear it for a few minutes, and you can do this throughout the day. And this has been shown to help with the oil layer of your tear film and being able to, again, not let those tears evaporate too quickly. So it's non-invasive. You can use it at home, and it really, truly, I've been using it because I suffer from dry eye disease a few times during the day, and it's actually been very beneficial. So again, they also had a study that I linked there below, which I won't talk to in depth about, but again, backing up the proof to show these improvements of the eye conditions with all of the different parameters that we've been measuring. So pretty fascinating, just by targeting, again, heat, moisture, again, non-invasive. The last area is acupuncture. Again, they also did a study here to show and look at the efficacy of true acupuncture compared to the sham acupuncture in treating dry eye disease. Again, it was a randomized double blind trial with 58 participants. And it really showed and indicated that in the group receiving acupuncture, they really did have improvement in the ocular surface disease index score and a reduction in symptoms that patients were describing lasting up to 6 months. So, again, other treatments that can be considered in looking at overall improvement in dry eye disease. And I think, again, really promising results. I'd be remiss as a dietitian if I didn't mention food sources that could be of benefit overall in our foods first approach. They may help to provide nutrients that support our eye health and improve our tear production. So, first up, omega 3 fatty acids. We talked about supplementation, but looking at food sources that could possibly help reduce inflammation, and that includes fatty fish like salmon, mackerel, and also seeds like flax seeds, chia seeds, and also nuts, walnuts. Vitamin A. This is essential for maintaining the health of the cornea and our tear production. Food sources include carrots, sweet potatoes, spinach, kale. Next, vitamin C. As an antioxidant, it can help protect our eyes from oxidative damage. And so, food sources are lots of fruits and vegetables, but again, the idea is to incorporate more when and where you can because a lot is found in fruits and vegetables. Vitamin E is also an antioxidant that can help protect the eyes from free radical damage, and the food sources would include almonds, sunflower seeds, hazelnuts, and spinach. Zinc, as a mineral, can help with the absorption of vitamin A and support the health of our retina. Food sources include oysters, beef, pumpkin seeds, and chickpeas. Next up, water. Staying well hydrated is actually essential for tear production and maintaining moisture in our eyes. So make sure to drink plenty of water throughout the day to prevent dehydration. Now, again, when we consider incorporating these foods into our diet, it could help improve symptoms of dry eye just by supporting our overall eye health and reducing inflammation. Thank you guys so much for tuning in to today's presentation on dry eye disease. My references follow on the next slide.